New census data shows the Hispanic population is the fastest growing ethnic group in the state. UT Health San Antonio Dr. Fred Campbell, who's been on the Medical School of Admissions Committee for more than 20 years, shares why promoting diversity in healthcare matters for patients. What are the values of a diverse healthcare system?
The Association of American Medical Colleges and UT Health both agree that a diverse population of students has a tendency to improve the critical thinking of individuals. Knowing diverse perspectives and discussing those can be extremely useful in developing a culturally sensitive group of students and future doctors.
And that's really important because that directly affects the outcome of the patient. Can you maybe share some of the consequences that do happen when there's a lack of diversity?
Yes, lack of access is one of the bigger issues, particularly in the lower socioeconomic strata. And then, of course, delay in making diagnoses on the basis of not being able to see patients on a regular basis due to usually financial considerations. It's quite often that patients will be drawn to providers who speak their language and to some extent those in their same socioeconomic group and ethnic group.
Is there a specific ethnic group that's lacking?
Yes, there is a diversity problem throughout the entire country. Of course, in Texas, where there's a much higher percentage of unrepresented minorities, that problem makes the provision of good, high-quality service to those populations much more critical. The school has officially, intentionally designated several groups, including Hispanic, Latino, African American, Black, women, and other socioeconomically underrepresented groups as their diversity categories. Traditionally, it's been difficult to find academically qualified applicants that could perform well in medical schools. Over the last 20 to 30 years, however, there's been a larger number of graduates that are in fact academically qualified, and it's a matter of making sure that those individuals are considered in the admissions process. There have been situations between perhaps leadership in terms of the deans of admissions where perhaps some of those priorities were not as specifically emphasized, and so, for instance, the percentage of women in our medical school has varied over the past 10 years. More recently, under our new Dean of Admissions, Dr. Kellaway, we've increased the number of women proportionately.
Not to get too much into the weeds of things, but what do you think hospitals can do? What do you think maybe the public can do to create our future doctors and nurses and medical staff?
Well, I think encouraging young people to go into areas such as science and health is extremely important. Again, encouraging the development of high schools and undergraduate programs that encourage minority participation, encouraging scholarship support. There is a state program called JAMP, which is a state-sponsored, taxpayer-funded program to target traditionally underserved and socioeconomically deprived individuals who could be medical students.
And can you share what San Antonio ISD is doing, building our future of medical students?
There is a collaboration right now between the school district and the medical school and medical society to put together a new high school for those individuals that have traditionally not been included in the healthcare leadership and could very well be encouraged to pursue health as a career.
Thank you very much to Dr. Fred Campbell. Last year, UT Health San Antonio ranked 7th out of more than 100 medical schools in the country on a national list for best schools for diversity.